Well, welcome to the Advocacy Academy webinar. I hope you can hear me all right. My name is Rachel Wilson. I'll be moderating the session today. And as I mentioned before, and as you can see on the screen, we're inviting people to introduce themselves using the chat function at the bottom of your screen, writing your name, your organizational affiliation, and if you have one, and where you're located. We're going to get started now, but you can continue to use that chat function. If you're having any technical difficulty, feel free to press chat to all panelists. Let us know what you're having troubles with, and someone on the team will do their best to help you. There will also be the chat box open for Q&A. So as you are listening to the presenters, please feel free to type questions, and we will track those questions. So this webinar is part of Women Deliver's Advocacy Academy. And for those of you not familiar with Women Deliver is a leading global advocate that champions gender equality and the health and rights of women. Many of you probably know Women Deliver as having one of the largest convenings of champions for women and girls globally every other year. And this year, Women Deliver will be having their conference in Vancouver, British Columbia, in early June. The conference will bring together nearly 7,000 people from across the globe, so it's really an incredible opportunity. The Advocacy Academy is a new component to Women Deliver's advocacy work. It's a skill building component, and it's made up of 3 parts that you can see on the screen. There's an online advocacy training that's available to those who have registered to attend the conference. So if you've registered to attend, you have access to take this interactive training that Women Deliver has designed. The webinar series is open to all. It's on 2 topics, as you can see. One is on citizen-led accountability and community engagement. The first is today. We will also next week have the same webinar, actually with different speakers in Spanish and in French. The second topic is on coalitions. So how to break barriers and build bridges across different sectors and interests to create change for women and girls. And we will again have 3 languages on May 14th. Will be English, the 13th will be French, and the 16th will be Spanish. Right now, this webinar has been filled to capacity, and so we had to close it, which is great to see the interest. Fortunately, we will be recording all of these webinars, so those who are not able to join us live will have an opportunity to listen in later. Part of the Academy also will be a pre-conference workshop, 2 days that will be held with people who have applied and been accepted to attend that pre-conference, and then some coaching and mentoring and facilitation of policymaker engagement for those participants in English, Spanish, and in French. This webinar is intended to discuss how meaningful community engagement and citizen-led accountability can be powerful tools for inclusive, rights-based progress. However, as we all know, building the room and political will for these processes can be challenging. So some of the questions our discussants will be looking at is, how do you make sure that the policies and programs reflect the needs and priorities of the people they're intended to serve? And how can citizens get a seat and a voice in the decision-making table? And finally, how can citizens help hold their governments to account and deliver the services that they need to prioritize? We have 4 incredible speakers with us today. We will start with Dr. Aparajita Gogoi, who is Executive Director of the Center for Catalyzing Change and the National Coordinator of the White Ribbon Alliance in India. We will then move on to Frank Ategeka, who is the team leader and co-founder of Rural Aid Foundation Uganda. And for our third topic, we have 2 discussants. Chris Lunch is the Director of Insight Share, and Angel Del Valle is the M&E Specialist for Population Council in Guatemala. Just so that you know about the format here, each discussion will have 15 minutes to describe how they use social accountability or community engagement to advance women and girls in their region. While the discussants are talking, we encourage you to use the chat box to ask questions. After all three have given their presentations, we will take the questions from the chat and direct them to the appropriate discussant to provide their perspective. If we don't get to all of your questions, and there's a lot of you, so I suspect we might not, we will ask discussants to answer the remaining questions in writing after the webinar. We'll provide a video copy of the webinar to you, the PowerPoint presentation, and the full Q&A answers soon after the webinar is complete. And so that we can get going, I'm going to introduce our first discussant. As I mentioned, Dr. Aparajita Gogoi from the Center for Catalyzing Change and the White Ribbon Alliance India has joined us, and she's going to share how the White Ribbon Alliance India mobilized over 150,000 women and girls across India to share their healthcare demands with policymakers through what many of you may have heard of already, but the What Women Want campaign. And it's really resulted in some exciting and critical shifts in national policies to advance maternal health. And it is now, as many of you have seen, evolved into a national global campaign. So I'm going to turn it over to Aparajita, who will tell us a little bit about her work and her lessons learned through that. So Aparajita.
Thank you, Rachel, and welcome everyone. Thank you for making time to join the webinar. As Rachel was explaining, I'm going to talk about this campaign called Hamara Swasth Hamari Awaaz. The English working title name is What Women Want. We are in the second year of the campaign, and today I will be focusing mostly on how the campaign started. How did we actually deliver and implement? What did we do with the results, and how it has gone to the next phase of this particular campaign? Rachel, can I request to change the slide? So why did we do this campaign? Primarily, we know that a lot of work is happening at the systems level, at the government's level, to provide quality of care, good services to women, to children, to people who are primarily at the bottom of the pyramid. However, despite all our good intentions, very often we overlook, forget, don't know how to really amplify women's voices and hear from them to understand what does quality of care, what does good quality services mean for them, what is important for them, what is dear to them. So that was the reason why we designed this campaign. It was locally designed, and our intention primarily was to really figure out a mechanism to place women's self-articulated needs at the center of policies, programs, and also look at how can we bring in women into an accountability framework which starts at the bottom at a district or a subnational level, bring it up to national level, and hopefully to international level. So the idea germinated this way. We wanted to amplify voices of women, but then when we started designing the campaign, the first question was, how do we reach out to women and how do we ask them to articulate their, for example, their most important ask when it comes to quality of care. We looked at what could be the right medium, what could be the right approach. Everybody talks about the reach of technology and a scalability through technology, cost efficiency. But when we went to the field and looked at the kind of women that we want to bring into the fold, what is their access to technology? What is their literacy level? How free, comfortable are they in kind of adopting technology for certain campaigns like this? What we realized was that, of course, the women that we are reaching out to are not in that frame in their lives where they can adopt and use technology. So we went back to very simple offline collection through postcards. So this was, again, it took a lot of thinking to figure out if you're asking women to put down their one ask, how do we collect it? We did not want this to turn into an unwieldy research survey. So we designed a very simple postcard where we asked women, just put down what is it that is most dear to you. So if you go to a health facility for maternal care, for childbirth, for ANC, PNC, family planning services, what is it that you want? Then we looked at how do we reach women on the ground. So we looked at partners who are already on the ground, who already have a relationship with communities, who are quick on their feet and can move very quickly. So the first thing was to design how we collect it, including the postcard, including partners. Then we also went into this whole conversation about how do we deal with issues of consent? How do we explain the campaign to women? How do we explain quality of care to women? Because as you know, if you ask 3 of us on this webinar to define what is quality of care, all 3 of us would come up with different definitions which fits our perception of quality. So we did a lot of work around this, and I'll be happy to share offline how we arrived at this. But we also realized that it is important to ask women their consent, which meant that we tell them why we are doing the campaign, what are we going to do with their voices, and what are ways we want to adopt to get back the campaign results back to them. So this was the starting point. We trained the partners, we sent out the postcards. Partners spoke to women in certain circumstances, one-to-one, in certain places in groups. And women started writing down their ask, and we were pleasantly surprised when women said, no, I do want my name and my signature and my phone number and my village here, because this is a way my voice can be heard. So over about 4 to 5 months, we started with an aim of 50,000 asks, but we ended up with over 150,000. Next slide, please, Rachel. Yep. So if you all can see the slide, the graph on the left is a depiction of what women asked for. So you can see that we categorize their ask into various categories, that they asked for dignity and care, availability of health providers. So when we got the ask analyzed and categorized, that was our first step that we kind of overcame. But then the problem was really to understand when women said, for example, dignity and respectful care, what did they mean? So we went back to the data to figure out what do women mean, and we found out there were 8 categories that women said should not happen to them. They do not want to be, for example, subjected to physical abuse, verbal abuse, didn't want to share their beds and their stretchers, etc. And then our challenge really was that once women have asked for certain things, how do you turn them into practical, doable asks that we can ask national level people, state level people, ground level people to commit to and deliver? Then we went to this act of curating right call for action for the right target group. For example, when we presented our Charter of Demands from Women to the National Health Minister, ensuring that government guidelines include respectful maternity care, ensuring that there is zero tolerance for disrespect and abuse in facility was one of the kind of upfront top asks that we put forward to the National Health Minister. But when we went to, let's say, a local elected representative, we curated that in her position as a local elected representative, what could be something that we could ask her to commit to. So to summarize, what we did with the ask was to really turn demands into something doable, committable, then taking the right ask to the right people, and then also looking at how do we reach the right people? What are the different mediums, one-to-one meetings, large events, writing letters to the health minister, using the media, etc. So that's how we took our campaign to the right people whom we thought were in a position to make a difference. Next slide, please, Rachel. I just wanted to talk about the importance of, taking your campaign, taking our campaign to the public. We invested a lot of thinking, a lot of efforts in getting the campaign asked out to the media. So whether it was a 21-minute long film, which was aired by India's kind of highest watch English news channel, or getting op-eds, middles placed in newspapers with very large circulation. We invested our time in this because we also thought that beyond our usual targets like the government, it is really important to also reach out to public. For example, when we are talking of women's participation, when we are talking of treating women with respect and dignity. So this is just an example of one of our dissemination strategies. Next slide, please, Rachel. So we often talk about what's the point of doing advocacy campaigns when we do not really arrive at outcomes which directly emerge from our campaigns. We did have different levels of outcomes at different states, different regions. But what we have included today for you is just what did we do with the ask for respectful maternity care. We followed up with research to understand what's happening to women, what is the perspective of providers when women ask about respectful care. We didn't want to put any blame on any part of the system. We wanted to include everyone's voices, wanted to highlight some of the things that need to be looked at if women were to be provided respectful maternity care. So after all the mobilization, we are happy to report that today, respectful maternity care is part of national guidelines to improve quality of care in labor rooms. Other skill guidelines, like the guidelines for nurses and auxiliary nurses, have included respectful maternity care. We are working with government facilities in helping them implement certain protocols which will ensure respectful care. So this is just an example of one of the outcomes of the campaign. Next slide, please, Rachel. So this is the last slide. I think the organizers of the webinar was pretty clear in saying that we need to also look back and see what are some of the best practices, what could be some of the lessons learned, and what could we do hereafter. So I've put together a couple of best practices, and these are basically learnings from the campaign. What we learned that we may design campaigns sitting in one place, but it's really important to be open to changes. You need to look at what iterations are required to make it work. You have to be open to revisiting your original plans and tweaking strategies. The second best practice that we learned was, instead of having one kind of a general charter of demands or asks coming from it, and generally disseminating it and not really getting very far, how important it is to curate the demands for different target audiences, and then ensuring what are the right strategies that we adopt to approach the right people for the right results. The other thing we really were very proud about the campaign was that, like I said, this was a locally generated, curated campaign, and it kind of reaffirmed our belief that when you partner with local actors, how quickly things like this turn from plans to reality, and how much of credibility local partners bring in. However, there were challenges, like in most advocacy campaign. Initially, when we took our ideas to for example, for donors, there was a lot of apprehension, because in many countries, forums for voicing, for asking for accountability is kind of shrinking. And there were a lot of questions about, what if women would ask for this? What are you going to do with that? How will you present? So I think now we are pretty clear, how do you present your campaign ethically, truly, and how do you say that this campaign would be a true reflection of women's voices, irrespective of what comes out. The second challenge we faced was, like I had said initially, we thought that if we get 50,000, we'll get there, we'll be happy. We didn't really kind of predetermine that this campaign would really catch on, would get traction. And we were in the middle of maybe 2.5, 3 months down, we were bombarded with postcards arriving from all corners of the country. It had the target had tripled, and we were on the back foot trying to figure out where are the resources to, for example, do simple but important things like get an agency to enter, clean, and organize the data into tables. So that was another challenge. And then the question that we kept asking primarily was that, yes, women have asked for certain things, people have committed, but how do we really ensure that some, if not most of the commitments are being acted upon? And so we started from local levels making tracking sheets. So if a locally elected leader has said that there is difficulty for women to get to facilities, and I will fund 4 ambulances from my local area development funds, did that happen or not? We couldn't do it for the whole country, but wherever we could, we started creating simple tracking sheets to capture impact. I just want to end by saying that this campaign, I think something worked. I think what people thought was this is important to get women's voices front and center. Very important was also the fact that this is doable. And then the third fact was the issue. Sorry, that's my 15 minutes timer going off. And the third thing that we all learned was that this could be scaled up if we stuck to some of the lessons learned. And I'm happy to report that today it's a global campaign. From an Indian campaign, it's become a global campaign. We call it the What Women Want 2.0. Our target was to hear from 1 million women, and we have just crossed our target of 1 million. And the big reveal of the findings, the presentation of the ask will happen during Women Deliver. So with that, I am going to stop, and I look forward to hearing your questions, and I'll try to respond. And at the end of the PPT, we have put the web link to the What Women Want campaign website. There are implementation guidelines, communication material, guidance about how do you do surveys, etc. And these are very useful guidelines which different countries have adapted and used. So thank you so much, everyone, for patiently listening.
Thank you so much, Aparajita. It's really pretty incredible when you think about something that started with a target of 50,000 women in India and now has gone to 1 million women globally, and I suspect that will continue to grow. It's particularly gratifying to see something start in country and then become global, which is not always the direction things go. What we heard from you was a lot of really helpful information, but a few things I took away was that the need to meet women where they're at, figure out how do they best communicate, how do they want to communicate, what do they want to communicate, and figuring out the ways to make that happen, and really understanding your targets. Who do you want to influence, and what is the best way to engage them and influence them, and that may vary at different levels. And another lesson I think that's great from you is to understand and be prepared for success. And what a great problem to have, but I'm sure at the time it was difficult to handle. And in terms of the importance of partnerships in the local tracking, one thing I would like to just share from the chat is that we're seeing from other people, Jacqueline in Cameroon talking about how the need for respectful maternity care is an issue that has global resonance. So thank you for that, Aparajita. Please do ask your questions in the chat box. We will be collecting those and sharing those with the discussants at the end of the presentation. So use your chat box to ask those questions. So next we have Frank Ategeka. He's from the Rural Aid Foundation in Uganda, and he's going to share how he and other children of refugees and Rwandan genocide survivors have used district health assemblies to facilitate dialogue between marginalized populations and local duty bearers. And this work has really led to some exciting social accountability mechanisms that have prevented corruption by healthcare workers and increased the return of girls to educational institutions. This young man has done an incredible amount of good in his time on this planet, and I'm really glad to give him the opportunity to share some of that with you. Let me make sure I unmute you. There you go. Welcome, Frank.
Thank you so much, Rachel, and the rest of the participants for this meeting. I want to talk about briefly Rural Aid Foundation. Rural Aid Foundation was founded initially as a community-based organization that was founded as an intergroup platform between refugees and Ugandans in Uganda. I mean between Ugandans and refugees. Rural Aid Foundation was founded as an inspiration for myself and also a team of other young people who were born as a result of intermarriages between Ugandans and then the refugees who had fled the genocide in Rwanda. And today I'm here to talk about the Community Health Assembly, or what we call the District Health Assembly. That is a model that is used to empower refugees and rural communities to hold duty bearers accountable for quality health care services. Due to the vulnerability of refugees and then the rural communities, and also the limited confidence among refugees and the rural communities, it was very hard for them to demand accountability for improved quality health care services due to issues of illiteracy, issues of economic barriers, and so on. So this model is basically used to bring together the refugees, the rural communities, and then the duty bearers to a common platform. As you can see in the picture on your screens, the first box down, we have duty bearers, we have right holders who are usually refugees and the rural communities, people with disabilities, adolescent girls and young women, and the youth, basically within the refugee settlements and also the host refugee communities. And when these members come on board, they are able to tell their issues to the duty bearers. And the issues include health violations, limited access to education, economic empowerment issues, sexual gender-based challenges that are usually happening in the rural communities. And then at the end, the duty bearers are expected to give answers to each of the issues that have been raised by the community members. And one key thing to note is that during the Health Assembly, we focus more on the community voices to ensure that the rights holders are able to state their health challenges or the issues that they are facing directly to the duty bearers. Among the issues that were highlighted previously in the 2018 Health Assembly, we had issues of sexual gender-based violence. We had issues of limited access to education and post-school dropouts for adolescent girls and young women due to early marriages. And during this entire process, Rural Aid Foundation plays a moderatory role, or we do mediation, where we capture all the issues that have been highlighted by the community members, the refugees, and the rural communities. And then we compile these actions that have been suggested by the health workers. For example, if the issue has been increased sexual gender-based violence within the refugee settlement or the rural communities, and it has been raised by the villages and the refugees themselves, then the duty bearers have to suggest a solution to it. And Rural Aid Foundation documents this solution in terms of an action plan, and then we compile all those issues that have been suggested together with the solutions that have been highlighted by the duty bearers. And at the end of the health assembly or the community assembly, we provide copies of those suggestions or action points to both the rights holders and then the duty bearers for effective follow-up and implementation. Next slide. Rachel, next slide. Okay. As you can see in the two pictures, on the left, we have a team of health workers in Western Uganda during the health assembly. The refugees suggested that there was increased limited access to family planning services and then increased sexual gender-based violence within the refugee settlements and then the host communities. So the gentleman you can see in a blue t-shirt was actually a Rural Aid Foundation team member who was documenting the challenges that were being raised. And then the duty bearers were able to suggest the solutions that was actually putting down. And on the right, we have a team of young people from the rural communities, mainly adolescent girls and young women who were part of this dialogue, and they suggested issues of increased school dropouts due to forced marriages. Let's proceed. Next slide. Next slide, Rachel. Okay. The community health assembly or the district health assembly has been able to achieve the following outcomes. We have seen increased staff and less absenteeism by health workers in health facilities. This was one of the issues that was raised in the 2018 Community Health Assembly, where the community members and the refugees reported that every time they go to the health facilities, they don't find the health workers because most of them are absent, or even the health work facilities had limited, they had few health workers. Then also, we've seen reduced drug stockouts in the public health facilities, in the public health facilities. This was one of the issues that was raised quite often before the 2018 Community Health Assembly that we had. Many health facilities lacked drugs, and many people or many refugees and host communities were forced to go and buy drugs from the private-owned health facilities, which was pretty much expensive for them. Then we have the comprehensive refugee response framework has now been prioritized at community level, and also the sexual gender-based community policy has been developed by the Uyanja Youth Forum. Following the 2018 Community Health Assembly, many people reported that there was increased sexual gender-based violence, as I stated earlier, and then the Uyanja Youth Forum were able to sit down and then develop what we call an SGBV policy, which is a bylaw at a community level, and then it was able to be, they were able to present it to the district, and then the district was able to support it in able to curb the high rates of sexual gender-based violence. Then the UNHCR has the comprehensive refugee response framework that is intended to integrate refugees and the nationals or Ugandans in accessing healthcare services from the same health facilities. But previously, we had a lot of discrimination by the health workers who preferred providing healthcare services to the Ugandans than the refugees. So when Rural Aid Foundation came and discussed the issue of comprehensive refugee response by talking to the health workers, and then this issue was also presented during the assembly, this has been able to change. Then the Refugee Health Care Plan has been launched in Uganda as a result of the Community Health Assembly that we conducted on Universal Health Coverage Day last year with support from Global Health Strategies. And on the right, you can see the first picture on the right. You see government asked to prioritize refugee health care. Before we did the Community Health Assembly on Universal Health Coverage Day, the government didn't have a clear picture of how to involve refugee voices into the advocacy for universal health coverage. So when we conducted that Community Health Assembly, we invited the Minister of Health and then also representatives from CSOs, the UNHCR, and other CSOs that are working with refugees in Uganda. And then the refugees were able to present the challenges that they face in accessing health care, including sexual gender-based violence, drug stockouts, limited access to education, and so many other challenges. And the government responded by launching the Refugee Health Care Plan that is meant to include the refugee voices and challenges in the National Health Care Plan for universal health coverage. And then we've seen a reduction in corruption among health service providers and justice actors. Last year in 2018, during the Community Health Assembly, refugees and rural communities reported that there was an increase in corruption by health workers and justice actors asking for money from them when they went to report health cases or even health violations. Then as a result of the Community Health Assembly, we have been able to see a new model that has been developed, the Back to School campaign that has emerged out of this assembly. This came as a result of the many reports that were presented by the refugees and the rural communities that many girls were actually being forced to drop out of school by their parents to go into marriage, and then because girls are looked at as a source of income. So our issue, when this was reported, the Back to School campaign was developed and adopted at the last year's assembly, and then we have seen over 100 adolescent girls and young women rejoining school in the year 2018. Next slide, Rachel. Next slide, Rachel. Okay, now the best practices and lessons learned. One of the things that we've seen is that our community awareness for the assembly helps to maximize the assembly. If the attendance, if you want to organize a community health assembly, you need to start to give it a lot of time to ensure that you do a lot of mobilization for all the community health, the community members, the refugees, the refugee leaders, and then also the duty bearers. Then the other thing is that formal invitation of duty bearers in form of writing formal letters to the respective officers or duty bearers based on the identified gaps increases their acceptance. As you know, the nature of political offices, many people will not turn up if you just send them an email, but rather writing a formal invitation letter will increase their awareness and also support for the activity. Then the presentation of evidence, verbal testimonies from those that are affected is great proof. During the assembly, we as Rural Aid Foundation, we don't speak, but we get the people, all the refugees and women and girls who are mostly oppressed and facing these challenges to speak on their own. And they speak in front of the duty bearers to ensure that their voices are heard. Then the power mapping to inform strategic outreaches helps to get the right people. Sometimes it is very good for us to map out the authority lines. For example, if I'm inviting someone from the district health team, I make sure that I invite the head of the health team. Because if you invite the subordinates of the head of the health team, people will not see value in it, and others will actually absent themselves from that assembly. Then the lessons learned. One of the things that we've learned is that opposition is something that you cannot do away, particularly from political leaders who look at the community health assembly model as a fault-finding tool. In other words, they think we are there to audit them and find gaps in the work that they are doing. However, we've been able to mitigate this by engaging them, engaging the political leaders and also the local leaders in the project inception meetings to identify and also identify the reporting lines. As we do the project inception meetings, we do reach out to the highest offices in the district to ensure that they are aware of the project and also inform them of the assembly in advance, such that when we invite them, they are not caught unaware. Then next, we have the rights awareness sessions to increase community confidence. Due to the vulnerable nature of refugees and rural communities, due to issues of illiteracy, limited economic empowerment, they quite often lack confidence to speak in public in front of the duty bearers. So what we do, we mitigate this by doing rights awareness sessions for the refugees and host communities, where we tell them about their rights to health, their rights to prevent sexual gender-based violence, and their rights to say no to early marriages and forced marriages, and their rights to stay in school. So with this, we are able to create confidence in them to be able to speak in front of the duty bearers. Then lastly, we've seen cultural beliefs and gender power gaps that have always hindered the participation of women in such community dialogues or during the community health assembly. And because the women in most parts of Uganda are not, particularly in rural communities, are not supposed to speak in public on issues that affect them, we set what we call the pre-assembly rules and regulations for equal participation of women, and we give them priority to give their issues. And also, we invite women leaders as part of the duty bearers so that they are able to speak in confidence by picking from the duty bearers who are women duty bearers as well. And lastly, we want to elevate this model to what we call a National Health Accountability Summit, or what we call the National Citizen Health Engagement Summit, where we can hold it at national level and then invite representatives from the Minister of Health, representatives maybe the Minister of Health, representatives from Uganda Parliament, where we have the Uganda Health Committee in Parliament, then representatives from CSOs, and also representatives from the refugees and the rural communities, who will be able to come and speak in front of the national leaders about the issues that are affecting them in their different places of residence. And just like the previous speaker, Dr. Parajita mentioned, citizen-led accountability is still a very big challenge in most countries, and particularly in Uganda, because many people will think you are demanding for accountability, accountability from duty bearers, and they will think about it as in terms of a political move. And for that reason, many organizations have not been able to do it. And the government also has not supported it in terms of funding for citizen-led accountability. And as we speak about universal health coverage, citizen-led accountability is one of the things that will ensure that all states access or all states achieve universal health coverage. But this can only happen if the states and countries can be able to support it in terms of funding, and also support organizations that are working in the grassroots for people who are very vulnerable, like refugees, women, adolescent girls, and young women, and also the youth. I think with that, thank you so much.
Great, and thank you, Frank, for providing us with a really interesting and compelling model. A couple of things that I took away from that, really similar to what Aparajita spoke about is really taking the time to understand the people that you're trying to give voice to, and helping to give them that space and confidence to use that voice. Again, understanding the target audience. You talked about power mapping and really understanding the hierarchy and how to approach that hierarchy in a way that maximizes getting the right people into the room. Also, I think an interesting comment from you is around engaging the duty bearers throughout the process so they're not taken by surprise, because we do see this, that they can feel a bit under attack when it comes to social accountability, but having them understand that what this process is early on may help to address that. So thanks so much, Frank. I encourage all of you to continue to ask your questions in the chat box. We're not using the Q&A function on this, so please do use the chat box. And at the end of the presentations, we will share some of those questions with Frank and the other discussants. And also bear with me, there seems to be a bit of a delay in the switching of slides, so sometimes you may not see it happen quite as quickly as as I'm clicking. The next presenters are two. Chris Lunch from Insight Share will talk about the model that they use of participatory video, and Angel from Population Council in Guatemala will talk about how that model was actually used to facilitate change with the Girls for Change project in Guatemala. I'm going to pass it over to them to begin now.
Thanks very much. Thank you, Rachel, and thank you for those two great talks. Really interesting. I really want to build on what I'm hearing. Really, it's we're talking today about participatory video. So I want to think a little bit about why, first of all, why video? I guess all of you, if you reach into your pockets or maybe into your hands right now, you're holding video cameras in your hands or in your pockets. Many of us have smartphones and videos now. It's ubiquitous, and we know how powerful it is for communicating. But the way we use video, we try and go beyond that. So we use it as a collective process. So that's why the participation word is there. It's the key really to the kind of the power of this process is bringing together different groups to work collectively on creating videos. But again, it's not just about video. Really, for us, it is about creating relationships, strengthening groups' power over the processes and the programs they're involved in. I've heard some really great examples just now about handing over power to the beneficiaries, to the target groups. So really, that's what we're aiming to do. And Angel will be able to talk about how this participatory video work was able to lay the foundations really and help them build a movement. The Population Council chose a difficult topic. In Guatemala, they chose not only rural group, but also indigenous group. And then within that, maybe some of the most underserved populations in Guatemala, adolescent girls. And so that was already a big challenge, how to reach those groups and engage them. And then that wasn't enough of a challenge. They wanted to make it even harder. So let's look at, they decided to look at sexual health education and overcoming violence in the home. So how can you deal with those kind of issues? How can you look at those kind of issues with indigenous adolescent girls? And then how can you bring video into that? So it doesn't sound easy, but actually it worked like a dream. I think the key here is we were doing monitoring and evaluation, and in our industry, I think it's one of the few industries in the world, if you look at the private sector and other areas, where we don't go enough to the kind of users or the beneficiaries and hear really what is working and what isn't working. And we wanted to do more to kind of improve our whole sector and look at some of the systemic shifts that need to happen. And the way we focused on that is developing methods to do monitoring and evaluation, which is really led by the beneficiaries. So I'm going to pass over to Angel now to be able to present this example of how we've used this in Guatemala with the Population Council and Insight Share. Thank you.
Thank you, Chris, and thanks everyone for the invitation, and thank you for the previous presentations. So what Chris was describing happened in the context of an ongoing program designed specifically for adolescent girls. And as Chris was mentioning, in particular for indigenous girls in Guatemala, who are one of the most underserved segments of the population. As adolescent girls reach puberty, school enrollment rates start to decline, and they reach a point where only 60% of girls will be enrolled in school once they reach age 17. And in these rural communities that are usually under-resourced, girls are left with barely any alternatives. So in this setting, and as the program was being implemented, we were looking for ways to better understand how girls, families, communities were understanding what the impact of the program was in their lives. So we had a good sense of what it meant in terms of monitoring metrics, in terms of evaluation assessments. But given that we dealt with different ethnic groups across the country, there was always this challenge on how we could better understand the needs of girls. And fortunately for us, the model that we implement contemplates a key element, which is the mentor. So the mentor is a young indigenous woman that lives in the community with girls. She gets trained regularly to set up the weekly meetings that are offered to girls on a regular basis over a period of at least 2 years. So these young indigenous women often face the challenge of assuming a leadership position in a community that's somewhat conservative. You know, indigenous communities are pretty much male-led, and because of the structural issues that they face, often reproduce negative social norms that play against the interest of girls and adolescents. So next slide, please. So these mentors, these young indigenous women were trained not only in the participatory video methodology, but also in the most significant change technique that sets up circles of community members that included girl participants, mentors themselves, other young women in the community, and most importantly, community leaders. So these leaders were responding to the question, what has been the most significant change in the community since the program started running? And girls, mothers, and other members of the community were responding to the same question. So what is relevant here is that girls that usually participated in the program through the regular mechanism of attending weekly meetings, being exposed to a curricular guide, and mentors that were also participating as leaders for girls, had the space to share stories, and they identified that they shared a collective vision of change, meaning that mentors from across regions, when they had the chance to see the screenings, when they had the chance to hear to other stories, they identified that the issues affecting their lives were similar across regions. And so this storytelling mechanism, which, by the way, it's, you know, given oral tradition in these indigenous communities, it made a lot of sense, provided girls and mentors with a platform for their voices to be visible, basically. And introducing video gave this dynamic sense to communities. And so you can imagine community leaders being baffled by this group of young indigenous women handling the video camera and also facilitating stories of change. So from the side of the impact that girls were trying to communicate to us, you know, the program practitioners, we learned that there were 6 areas of intervention that were relevant to them. And much of them we knew, but we didn't expect that violence against girls and women at home was going to be one of the key issues for them. It kept on emerging in the storytelling processes. And I think that's one of the virtues of this methodology, that as you give people the freedom to speak about what's meaningful to them, the fact that violence took over a big piece of the narrative led us to make some important changes in the way we delivered content, in the way mentors related with community leaders, and allowed us to see that the need to make connections with institutions that were actually good at delivering services in the prevention and attention to violence against girls. So one of these institutions is the Office for the Defense of Indigenous Women, which is the only institution at the country level that provides services for women in their language and adapted to their cultural needs. So if we go to the next slide, please. The participatory video and the stories of change then, as I was saying, provided mentors with the opportunity to become storytellers. And they use these skills to influence decision makers. Given the way that communities, indigenous communities work, the most immediate level you can influence is not only your local community council, but also the council district. The district is the closest level of political negotiation that mentors have access to, and being able to influence this heavily male-dominated space usually requires skills. And the storytelling and participatory video empowered these mentors to use their voices, use their stories, to advocate for issues like raising the age of marriage, which was previously legally considered to be 14 years of age for adolescent girls, and was later on a law was passed because of much of the advocacy that these mentors led. It was raised to 18. They also constantly advocate for the provision of sexual and reproductive health services, in particular for adolescent girls that become mothers before the age of 18. They also advocate for comprehensive sexuality education and for the overall school coverage to increase. And so the young woman that you see on the right on your screen, Claudia Max, is one of the leaders that emerged from this storytelling movement. So Claudia is now a national leader. She's actively working with UN Women to assess their policy on indigenous people, on gender. She's still an important liaison with the municipal council, with government institutions. She's enrolled in university. She's the first person in her family to go to university, and she continues to be a mentor for other girls and other women. So if we go to the next slide, mentors like Claudia actually allowed us, programmatic people, to see and understand that the best way to support these mentors is not necessarily through the expansion of programmatic coverage, which is important, but there's usually no exit strategy once you implement these projects. So for us, the important lesson learned is that we needed to give up the space for these mentors to actually use their voices in a way that was participatory, that was visually impressive. And one of the best practices was that it served as a channel for different regions and different ethnic groups to connect and see that there's a common vision. The training that was provided by Inside Share was really outside of this world. These mentors that got trained were between the ages of 15 and 24, and they were very young. It was the first time they were managing using the camera, and the way they were trained was actually meaningful to their learning, and it's skills that remain with them to date. So as we shaped our understanding of what was meaningful for these girls and for mentors, we transformed the way the program was delivered. We improved the content, and a recent impact evaluation on the Abriendo Oportunidades program, or the Opening Opportunities program, actually showed a positive reduction of the experience of physical violence at home for these adolescent girls. So as mentors continue to plan for the futures they want for themselves, and as they keep on working with girls, our role is to keep on looking for these kind of tools to maximize their voices, to amplify their voices and accelerate change, the change they want and need in their communities. So Chris, back to you.
Okay, well, great. So lovely to hear that. It's a program that we're so proud of, and so happy to be able to work with Angel and the Population Council, who already had such great foundations in place, and this model of really handing over control to these girls, and we were able to just build on that really, and help them much more than evaluation, much more than making videos. This was about helping them go from being citizens, villagers, to actually being change makers, and to be able to build those skills, which from the awareness raising, that when they had to listen to all these stories, they collected these stories with their peers, 30, 60, 100 stories you listen to from your peers, you start to see patterns. We did analysis using drama and games and drawing, so making it appropriate, but we do that actually with adults as well, and even in Western countries, because keeping it visual, keeping it dynamic stimulates the creativity and imagination. So we're always using those kind of methods. And these girls grew in critical consciousness, really. They grew in confidence and in awareness of what the big patterns were and what were the big problems. And so they became equipped to be change makers. And it's beautiful to hear the story about Claudia. And I know there's other examples of some of these girls who've turned into very powerful local women who are able to bring their community, and they still have this very much this sense of wanting to share and mentor others, and so the cycle is continuing, and it's a real it's thanks to Angel and his team and the Population Council on the ground who have been able to do the long-term work, that they've achieved such great outcomes. So thank you very much. Here are some resources, sorry, just to show that you can download a toolkit that we've created on participatory video and most significant change, which talks about this case study as well as others, and that's free to download. And then there's a few other, there's the website that was created for this program where you can see some of their videos. And yeah, we're based in UK, in Oxford, so we do trainings in Oxford, but we also have trainers all over the world and work on different programs all over the world.
Great. Well, thank you so much to both of you for that great presentation. I think one of the themes throughout is that the storytelling was a model that was familiar and comfortable for the girls, but became one that gave them even greater skills to advance their voice in policy. One of the things I remember Angel telling me is that even some of these girls are thinking about running for political office, something that they had never considered before, which is really exciting. And the fact that they raised the age of marriage through that advocacy is really pretty incredible. The other thing I'm struck by is, you used this most significant change model in asking that one major question of these girls and having them tell the stories of that most significant change. It reflects that similar request by White Ribbon Alliance for the one demand and their priority. So the urgency of that. I encourage you all to please ask your questions on the chat function for the discussants. We've gotten some questions so far, and I will start to ask those of the specific discussants. And let's see here. I'm also going to need to manage the muting. So first for you, Aparajita, I'm going to unmute you. And one person actually from the WHO in Geneva wanted to ask you a little bit more about how you work on amplifying women's voices, specifically how the amplification changed national policy. So beyond the service implementation and provision change, what was that actual national policy change? Can you say a bit more about that?
Sure, Rachel, thank you. I think the first thing I want to say is that not all, actually most of the demands from the women did not really require any policy change. I think most of us are in countries where policies are very good. The problem is in implementation. When we disaggregated the demands and took it to the local levels, the solutions also were local. It could be around unlocking at local level certain money that rests with the health society. Somewhere it was around, ensuring that service availability is happening. So it actually took us a bit by surprise that a lot of solutions could happen at the local level. So there were only few elements which could feature into larger policy changes. So for example, I talked about the new policy for improving quality in labor room. A lot of aspects are already there, but we got in respectful maternity care also to be part of this big policy. And the other thing I want to say is that just demands from women and articulating that sometimes may not change policies. So you need to back it up with other advocacy strategies. And in this particular instance, we did very quick research in 5 states to figure out when women say disrespect and abuse, what is happening, why is it happening? Is it happening because there's overcrowding? Is it happening because disrespect has been normalized? And then the findings, how could it be inserted in different protocols? One example is that we have started the advocacy and hopefully will succeed in integrating chapters on respectful care for women in the national syllabi for nurses. The other thing that came out was that yes, these demands are good, but it is not doable. If I'm a health provider trying to manage 15 women giving birth at the same time, what can I do? So we also started on this road of creating a model, taking high load facilities, incorporating some of these protocols and really showing that can some of the demands be actually implemented. So the whole point here was that you need to look at what is the ask, where do you pitch it, what is practical, what is doable, what else do you need to be backed up by research, advocacy, where are some of the opportunities, and how do you tell the world that this can be done? I hope that answers the question.
Thank you for that, Aparajita. I have a question for Frank. One of the participants wants to know a little bit more about the change in reduction in corruption and how did you measure that? Can you say a bit about that, Frank?
Okay, thank you so much, Rachel, and the participants. One thing we need to notice that at Rural Aid Foundation, we focus on using focus group discussions before we go for the next community health assembly or the next district health assembly. What we do, we go to the communities and then sit down with the adolescent girls and young women. Of course, we have what we call the project rural team that is attached to every project that we do. So for this specific one, we have a team of young people that work as volunteers with the Rural Aid Foundation and also with one of our staff who goes to the community and holds what we call the focus group discussion and find out whether the issues that were raised by the adolescent girls and young women have been worked upon or they've not been worked upon. So through this focus group discussion, we are able to assess whether there are changes on the issues that were raised. So before we went for the last year's health assembly, we had that focus group discussion, and the adolescent girls and young women within the refugee community and the host village communities reported that the health workers and police officers, we are no longer seeking or asking for money from them when they went to the health facilities and the police stations respectively. Then the other thing that we use is before we start the district health assembly, after all the members or the participants have gathered, we do what we call key asks, where we raise questions on each of the issues that were raised in the previous health assembly to find out whether these have been addressed. And the community members do respond by a show of hands, but sometimes it also becomes a bit tricky because of confidence. That's why we opted to have the focus group discussions done before the next assembly. But also before we started the assembly, we do ask questions. Are you still requested or asked to pay money by police officers? And then the community members will either tell you yes or no. And then our parents is still forcing you into marriages without your consent. They will tell you yes or no. And then this is how we've been able to track it. A combination of focus group discussions and then the direct key asks that are presented during the before the assemblies. Thank you so much.
Thank you for that, Frank. We have a question for Chris and Angel. It sounds like the videos are truly powerful, especially because it's from the community members themselves. The question is, how have you handled or mitigated any risks that come from creating video, especially with women in vulnerable populations like Indigenous women in Guatemala?
Okay, I'll try and answer that. So the key thing about participatory videos is that the videos, anything that is filmed, is watched by the group, and then they decide whether it's shown wider or not. So they control the where it's diffused and where it's shown, or if it isn't. So that's a key angle. So really, that means that they're able to, they know better than anyone usually the risks, the real risks on the ground, the local situations, what can be said, what can't be said. And so there are cases where they will decide to say something in a different way, or maybe to address something differently, or to just take something completely out. There's a number of different levels of checks that happen along the way to avoid these risks. So in this case, for example, the girls were first showing the videos locally, and then to their peers, to other girls, and then to the wider community. And so that's another chance for checks, for people to say, oh, you really, this is a very difficult subject. I don't think you should talk about it in this way. Or some of the community leaders may be able to feed in their opinion, and the girls will be able to take that on, or the participants, the leaders of the process will be able to take that on board and make decisions based on this kind of feedback they're getting from their community. So these are the key things really that kind of avoid risks, the major risks, and keep a check. So it's really led by them, and because they can navigate that better than any external people.
And if I can add quickly to that point, we've been working with Indigenous communities for the past 15 years. And so we know there are mechanisms in which you have to negotiate and send messages. And that's usually a mechanism where you are constantly negotiating consent. So when you do the meeting with community leaders to tell them about a project, you are negotiating with gatekeepers to gain some kind of access to the community. When you get to the household, you do the same. When you get to the head of household, you do the same. And at the level of girls and mentors and other people in the community, there is this constant flow of communication, but it's also a lot of awareness on our side on what are the cultural mechanisms that are the appropriate ones for you to actually get a sense of what consent really means and how you get it.
Thank you so much for that, Frank and Chris. Aparajita, I have another question for you, and it's about whether you faced any negative feedback from this campaign. And if those were from any particular groups, or if you were surprised by any of that negative feedback, and were you prepared for this, and how did you handle any of that came as a result of this?
Thanks, Rachel. I don't think there were any kind of pushback or any feedback that we could classify as negative. However, when we first reached out for support, there were a lot of apprehensions from, bigger agencies about, like I had mentioned during my discussion about, what if women would ask for something which would put providers into a corner, etc. There were questions, oh, are you going to kind of take approval from the government before doing the campaign? And of course not, it's an advocacy campaign, right? So there were questions, apprehensions, not really, nobody said, this won't happen or you shouldn't do it. I think the difference also was the fact that this was a campaign being implemented by the White Women Alliance in India. It's an alliance of over 3,000 now entities, organizations. It's a group of organizations who have had 20 years of solidarity in promoting women's rights and health. So the message that we kind of said was, we are anyway going to do it. You're welcome to join. You may not join if you don't want, but we are going to do it anyway. So that, I think that the strength of the alliance in and understanding that something like this can be pulled off was a big kind of issue. The other thing was that, accountability is very increasingly becoming an unpopular, risky, difficult word to use. So the strategy we did was, although this is in some form fits into the accountability framework, but we were very careful about articulation in the ways that we use citizen engagement, amplifying women's voices, putting women at the center. So being a little careful about articulation. The other challenge that we faced, definitely not negative, was the fact that it took a lot to train partners across board about the collection and collation of asks. In almost a no or a low resource campaign, how do you get kind of a uniformity? So I think those were, so like I said, nothing negative as such, but some stuff that we had to think on our feet.
Another question for you, thank you for that, Aparajita. Someone asked about the steering committee, who initiated it, and how long did it take to set up?
Well, so when we started the campaign in India, we didn't really have a formal steering committee. We just sent out a call for partners. The secretary of the alliance with volunteers managed it. But when this campaign became global, there was a need for a steering committee to be set up. So I think the first step was really sharing the what's and the hows of the India campaign. Looking at the India campaign, a lot of partners kind of stepped in and said, we want to be part of the global campaign. White Women Global Secretariat on the behalf of everyone reached out to certain partners because we wanted a diverse group which would be in the steering committee. So reach out was done to specific groups. And it's not a very big steering committee, but it is a very important steering committee who steps in, intermittently, gets regular updates, advises. So that was the process.
Thank you, Aparajita. And someone also wanted to know from the other discussants whether you also faced any negative feedback, and if you can say a little bit about how you handled that. Frank, any negative feedback on what you worked on?
Thank you so much, Rachel. The negative feedback that we got as Raw Aid Foundation was mainly from local leaders and then the political leaders in higher offices, because they thought we are actually doing an audit of what they have failed to fulfill while they were campaigning to get votes from the electorates. That is from the rural community Ugandans. By then, on the side of the refugees, we had negative feedback from the refugee elders who value more of the cultural beliefs than anything else. So when it comes to giving a voice to women to speak about issues that affect them, issues like sexual gender-based violence, issues of girls being forced into marriage by their parents. This was something that we really struggled with while working with the refugee leaders. Because most of the refugees we work with are from Southern Sudan, Burundi, and also the Democratic Republic of Congo, who think women don't have any right at any cost to stand in public and blame a man or a husband for something that has happened, or even to just have that capacity to stand in public as a woman and speak in an assembly of more than 100 people. That is something that is not valued, and the elders, who are mainly men, we have always criticized us for doing that. However, we've been able to work with the district women leaders who have emphasized on the value of women's voices, and also because of the political system in Uganda that allows for women representation in leadership, we've been able to bring members of parliament on board during these community health assemblies to ensure that the voices of women are heard, and also during the assembly, the district women members of parliament, the district women leaders have also emphasized on having women speak about in public platforms.
Thank you for that, Frank. Did you, let's see here, was there anything else you wanted to add from the participatory video?
Well, yes. So maybe, just to echo Frank's point, there will always be leaders that are more conservative than others, men that will feel uncomfortable because the status quo is changing, but it's fewer of them and more of the other leaders that see this as positive change. And so in our experience, championing the cause with these men that actually believe in transformation has a positive effect. So yeah, that's the way in which we've been able to manage the negative feedback, that it's usually echoed through the voice of men that are just feel uncomfortable by giving up their privileges.
Thank you for that. I think we've addressed the questions that have arisen right in time. I'd like to pass over to Courtney Carson from Women Deliver to just say a couple of comments around the satellite events that Women Deliver is promoting, and how you can make a voice, find a voice for your project and program with Women Deliver. Courtney, is there, do you want to say a couple of words about that?
Thanks, Rachel.
I think you may have.
I hear some echoes.
Yeah, you may need to. You may have it open in two places there.
Is this any better? No. Better?
That's better, thanks.
Apologies. So thanks very much, Rachel, and thanks to all the speakers. This has been a really great webinar. And as Rachel mentioned, here at Women Deliver, we're gearing up for the 2019 conference, which will be the world's largest conference on gender equality and the health, rights, and well-being of girls and women. One of the elements of this conference that we care most strongly about is that it spur a global dialogue and help amplify the voices of organizations and individuals around the world who are doing essential work in this space. One way that we feel privileged to do this is by partnering with organizations as they host satellite events. Satellite events are events that will take place in communities around the world leading up to, during, and after the Women Deliver conference. They can be organized by NGOs, individuals, universities, multilateral institutions, or corporations. Formats are flexible, and examples include panel discussions, film screenings, receptions, or viewing parties of the 2019 Women Deliver conference. They can be as large or as small as you'd like, made up of a team of your own employees even. Thematically relevant events which you are already having on your calendar can also be branded as satellite events. And why host a satellite event? By registering as a satellite event, you access the opportunity to amplify your voice and your organization as part of the WD 2019 Global Dialogue, and to brand them as part of the global movement on the path towards a more gender equal world. You'll also receive a toolkit and ideas around publicity and partnership, receive the right to use a Women Deliver branded logo, and by utilizing the WD 2019 hashtag and other social media tools, you will broaden your scope and expand your publicity. More than anything, you will generate excitement for your event by marketing it as a part of an international dialogue for well-being of girls and women everywhere. So if you're interested in hosting a satellite event or learning more about this opportunity, please feel free to reach out to Women Deliver, and I will put my email address right now in the chat box.
Great, thank you, Courtney. And if there's any email, website address where people can learn more about the satellite events, maybe you could put that in the chat box as well. One thing, several of you have asked about specific examples or materials. Links to all of the websites for the participants have been put into the chat box, and so you should be able to find things there. We will be sending you a video of the presentation and the presentation itself, and so you should be getting that very soon, and we'll have all of those resources. If you have very specific questions, please also let us know. And we can send those to the speakers. A couple of things to say. First of all, I want to really thank the discussants. Each of you have shared really incredible work that you're doing. And I can see from the chat that people are finding it very compelling and helpful. So that's fantastic to be able to share those. We hope that everyone has found their time valuable on this webinar. We appreciate you taking the time, an hour and a half out of your day. We hope you've learned something new and been inspired with innovative ideas to advance your own advocacy through these conversations. One thing that we ask is that in order for us to make sure these webinars are as valuable as possible, we ask that you complete a very brief survey, just a couple of questions. That you will be asked to participate in when you leave the webinar. Just take a few moments to let us know the value you feel in this and how we can make these webinars even better in the future, as this is just the first of several. And thanks to Women Deliver for all the great work for women and girls. So thanks everybody, and have a wonderful rest of your day wherever you are in the world.